Welcome to week 38 of the Mama Stay Fit Pregnancy Week by Week update. In this video, we're going to share what might be still going on with baby at this point. They are fully cooked or mostly cooked at this point. What might be going on with you? And then I'm going to share how I am feeling in my 38th week of pregnancy because my baby is due any day now. So we'll see how many more weeks I will be a part of. And then Roxanne is solo.
Will we have week 39?
We will probably have all the way up to 41 weeks. But let's get into what to expect during the 38th week of your pregnancy. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm currently pregnant with baby number 4 and 38 weeks pregnant. So any moment now, this baby, maybe during this video, the baby can be born.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3, and I'll be going over what to expect with baby and you.
So Roxanne, what can we expect with baby during week 38 of pregnancy? What is even going on anymore? Aren't they done at this point?
They are pretty much fully cooked at this point, almost. But like we said last week, only 26% of babies are born between 37 and 38 weeks. So not many of you are going to have your babies at this point, but there's a 1 in 4 chance that maybe you are the lucky few that'll have your baby between 37 and 38 weeks. But what is happening during the 38th week? Baby is the size of a bowling pin or, surprisingly, a watermelon. They normally say baby is a watermelon at 40 weeks, so I was a little confused, but I think maybe it's like a winter watermelon. It's like a smaller watermelon.
A lot of people like to say it's like pushing a watermelon out of a hole that's the size of a lemon, but I don't think that that's accurate, and I think that's terrifying to hear.
Makes your watermelon does not adjust to your body. It's just a watermelon, whereas your baby adjusts and gets smaller, and also it's like a baby is not this wide.
Yeah. Like their heads are not that big.
Yeah,
but their skulls also are not fused, and so the bones of the skull can shapeshift as they move through your pelvis, and babies are mostly squishy.
Yeah.
At this point. So not a watermelon.
Not a watermelon. Not a great analogy.
And the perineum and the pelvic floor have a great capacity to stretch, which is, so it's not a lemon-sized hole.
To stretch.
It's a watermelon-sized hole.
Yeah. Yeah. Great point, though, Gina, because a lot of people are scared, like, I don't want to push a watermelon out. Well, you're not, so
it's not
you're not going to. So that's great. Check. But baby is the size of a bowling pin or maybe a smaller watermelon at this point, but again, will not come out like a watermelon. During the week 38, baby is almost fully developed, so their lungs still have a little bit more to develop and their brain still a little bit more developed, so that's why it's still beneficial that baby is in there if they don't want to come out yet. As well as their vocal cords now are fully developed, so they can come out screaming and crying for all the help or cooing, the little sweet noises that they make at the beginning when they're just like,
there are different noises that they make apparently for different things.
I saw that
they mean.
I'm very mind blown about that. So we're gonna test it with Gina's baby when she comes out. We're gonna listen to the different noises and see if that's
what helps.
If it really helps. Stay tuned. And just fun fact: your baby's head size at this point is the same size as their abdomen. Whereas, like, potentially as they get a little bit older, so 39 and 40 weeks, they might be slightly larger than their abdomen. So they'll always do a head circumference, a chest circumference, as well as an abdominal circumference. Maybe not the chest in every hospital or birth center, but at least the abdominal and head circumference, obviously, as well as the length. But the head and abdomen sometimes are the same and sometimes just slightly different, depending on the gestation of your baby and just genetics. If you have a large-headed genetics, maybe your head is a little bit larger than the abdomen, but it's really cool to kind of be able to compare.
The skull shape shifts. It gets smaller as it fits through the pelvis. So even if you have a gigantic head baby, they will squish through.
Gina needs to continue to tell her this.
My babies are all 99th percentile head sizes because I married a man that has a gigantic head.
Yes. But it's fine. We love them. But that's really all that's happening with baby at this point. They're just like finishing their final little touches, the little finishing touches on the baby until their full term, which is 39 weeks, which will be next week. Well, in a couple days for Gina. But what's happening with you, which obviously is a little bit more important at this point because you are probably a little uncomfortable at this point. You might be having those Braxton Hicks at this point that may be a little bit more uncomfortable and may be a little bit painful now that baby is a little bit larger and your uterus might be a little bit more irritable since it's being stretched out. Because again, babies are a little larger at 38 weeks than maybe when you started having some Braxton Hicks earlier on in pregnancy. How to tell the difference between Braxton Hicks and contraction, which is another common thing. So you might have what's called prodromal labor or early labor that just doesn't progress. And this is where you're having those wave-like contractions. So they build up, peak at the top, and then let off. And then all of a sudden they just stop. So you're having these wave-like contractions, but they never really increase in intensity or get closer together. They kind of just stay the same. And then at some point you peter off. At nighttime, you might start to feel these contractions a little bit more, and this is due to melatonin is released in our body at nighttime. And this actually makes you more sensitive to oxytocin. So it like increases your oxytocin receptors in your body at nighttime versus during the daytime. And this is why dark, dim environments during labor can be really beneficial because it increases that sensitivity to oxytocin, which allows your uterus to contract. So if you feel contractions at night and then you wake up and nothing is happening, you're still pregnant, it's okay. This is normal and this is good. This is actually preparing your body for labor. It's not doing nothing. So you might actually be starting to thin out in your cervix, and that cervix is starting to ripen and maybe even open. And hopefully this means your labor may be shorter if you do experience this prodromal labor, where you're just having contractions at night and they never pick up. How to know it's actual labor contractions, though, is again, they're going to start to increase in intensity and get closer and closer together. And ideally, we want them under 5 minutes, preferably usually between 2 to 3 minutes apart. And again, increasing in intensity where you're kind of starting, maybe you're able to talk through the contractions and then you're needing more and more support during the contractions. And then in between, you're no longer wanting to talk to people. You kind of want to be in your own world. That's a good sign. This is labor, and you should probably either call your midwife or go to the hospital or your birth location.
For me, I definitely was confused the last few weeks on, is this labor? Is this just Braxton Hicks? Is this going to continue? But when labor actually came, it was very clear. I was like, oh, this is really different. This is labor. And so I've been texting Roxanne, like, my Braxton Hicks are like 10 minutes apart. And then nothing happened. But
and
I
then
knew
like a couple
down,
hours goes by, and then I'm like, are you still pregnant?
No,
What's going
I'm
on?
still pregnant.
She just fell asleep.
But then nothing happens. So, but it's been very stormy here. So I've been having a lot of Braxton Hicks, but I typically have a lot towards the end of pregnancy. I actually was having some while you were talking about them.
I figured because
and my belly was just like hard.
So storms, so common times that people will either increase in contractions potentially or actually go into labor are storms, because that decrease in barometric pressure. So storming, lightning, tropical storms, hurricanes are all times that people are at an increased risk of going into labor, as well as full moons, because again, that adjusts
likelihood.
Well, if you're preterm, I guess that would be a risk. But yeah, term likelihood of going into labor increases between after 37 weeks if it's stormy, raining, drops in barometric pressure, full moons even. So I usually will look at the full moons before I pick my days, just in case. But those are all times that more people go into labor because of that drop in barometric pressure can like cause baby to go further in the pelvis and want to come out. Very intriguing. Other reasons, obviously, to go into the hospital other than contractions is if your water breaks. So if you have a big gush of fluids or you're just constantly wet, that would be time to think about if you're having contractions going in or thinking about when to go in if you're not having contractions. And we'll link one of our other videos on what to do if your water breaks down below. So something that you've been doing at every prenatal visit at this point are fundal heights starting around 20 weeks. And this is when they're measuring from your pubic bone to the top of your fundus. And that number should correlate to the week pregnancy, plus or minus 2. But at the end of pregnancy, this number could change and either be increased or decreased more than 2 based on different factors. One, baby could just be growing larger, and that's why that fundal height could be higher. Baby could just not be engaged at all anywhere near the pelvis, so then they're going to measure a little bit higher because they're not in that pelvis. But they could also be so engaged in the pelvis that they're now measuring smaller. So different reasons could be why they're measuring different ones, but usually they'll want to do an ultrasound or recommend doing an ultrasound just to make sure nothing else is going on, such as decreased amniotic fluid, and that's why you're measuring low, or maybe too much amniotic fluid, and that's why you're measuring higher. One of the most common ultrasounds that they're going to do is something called a biophysical profile, where they're looking at 5 different factors on the ultrasound, as well as doing a non-stress test where they're putting baby on the monitor, listening to baby's heart rate and monitoring for contractions to see if baby is showing signs of like being well oxygenated and thriving. With the ultrasound, they're going to look at your amniotic fluid level as well as different movements. So they're going to look for big movements of like the limbs, little movements of the hands, as well as are they breathing? Are they doing breathing movements? And all of those things will add up to a number. And this number tells you whether or not baby is likely going to be okay for the next week, or potentially we need to monitor baby closer and maybe move towards delivery because baby's not doing well. And this can be done at any point if the provider sees some sort of risk factors, or anytime after 41 weeks, they recommend to make sure that baby is okay to continue on with the pregnancy and that there's not any risks to induce earlier. If you have any high risk factors such as gestational diabetes or preeclampsia or any of those reasons and you're needing to be induced, sometimes they'll offer this as another alternative if you're wanting to kind of prolong your induction. And this is a great thing to talk about with your provider and decide with risk benefits whether or not this fits for you personally. But since we are 38 weeks past term, the one thing that a lot of people will state they're having is anxiety and stress of when is this baby going to come, as well as myself. I felt this all the time with every pregnancy, even though I knew the likelihood of me going early was pretty slim to none. We have our babies after their due dates, but it's still the unknown is very stressful and anxiety inducing, as well as like knowing what's coming with labor. And this is probably one of the hardest things to manage during the end of pregnancy. So we'll throw it over to you, Gina. How are you dealing with your end of pregnancy anxiety?
So at this point, I feel okay. Mentally, I'm thriving. But there will be, for me, in this one, I feel the most at peace that she's going to come whenever she wants. Because I'm like, she'll probably be late, whatever. Maybe she'll be early. I don't know. Like, so I feel like at ease with whenever she wants to come. But the planner in me is having a hard time because I don't know how far to plan my life. Like, well, should I buy a ticket to this place to go see this show, or should I plan to go to this event? So that's what's becoming more challenging, is trying to figure out the timeline for the next potentially 4 weeks, but then also the timeline after baby comes of like, when will I do things postpartum again? And so that's what's becoming most challenging, is the planning aspect of things.
I can totally see it.
And then there is just like a little bit of like curiosity, which can sometimes turn into anxiety of, well, is she going to come this week or today? Maybe tomorrow?
It could
3
happen
weeks
right
from
now.
So she can come any moment now, any day, any week, and potentially and maybe next month.
Yeah.
Because I'm right on the cusp of August and September. So that's what becomes really challenging, is the planning aspect for me, as opposed to I really want this baby to come now. Mostly because I feel like I still got a lot of stuff I need to do. And so I'm like, well, if she takes her time, it's okay.
Yeah.
But maybe don't take too much time. So talk to me when I'm 41 weeks and I'm still pregnant. And that's when I start panicking a little bit more, because at that point, my birth plans may change if I stay too pregnant. And so when that starts to happen is when I start getting more stressed out, because I'm like, well, what if she doesn't come in time and I have to like transfer my care? So that's usually what stresses me out more. Maybe that's not even a problem that I'm going to have. Right now, I'm still before my due date and I'm good.
I think for me personally, the things that I found helpful for end of pregnancy anxiety was planning and planning one thing every single day that I was going to do, whether outside of the house or like going to, that I was like, oh, it's okay if I miss it, but it's like something to look forward to. So I wasn't upset if I went into labor, because I think that was the part that always was the hardest, when I would wake up and be pregnant. And I'm like, well, I guess I'm going to just lay around my house today then. But having something to do was really helpful to like take my mind off the fact that I wasn't in labor and still pregnant. But also there are lots of like guided meditations surrounding end of pregnancy that I would listen to. Like they were like a couple minutes, nothing crazy, where I would just sit there, focus on breathing, and they'd just be like, your baby will come when they're ready to come. Like, your body is not ready right now, and that's why your baby has not come. Like all of these like different guided meditations of like, it'll happen when it's meant to happen. And if it's not, like, there are things we can do. So just let this go. And I found that really helpful. But I'm super into meditation like that.
Yeah, I've mostly just been occupying myself with making sure that I'm moving each day, because that's what keeps me the most comfortable. If I take too many days off from my workouts, then I start to have like a little bit more pelvic pain. And so continuing to be really consistent with my workouts, even in these final weeks, is really important. The volume has definitely decreased, and like the intensity level is much lower at this point because I'm just more fatigued. Like I am just very fatigued.
Oh yeah,
all
lots
the time
of
at
end
this
of
point.
pregnancy now.
So most of my workouts are like 30 minutes or less. I maybe go for like a walk or like walk on the treadmill or something afterwards. So at this point, I'm doing definitely a lot more like body weight movements, like very light weights, just to kind of like honor how I'm feeling. And with the mobility work that I've been doing, I've also been doing a lot of like pelvic floor and like birth prep exercises. That has been like a big focus in the past few weeks for me. So last week I had an appointment with our in-house pelvic floor physical therapist, Haley, because you can see a pelvic floor PT even during pregnancy. And I do find it especially beneficial towards the end, just to kind of see like what's going on down there to make sure everything's good. I've been having some more like on and off like discomfort with like my right SI joint area, and been trying to do like my own movements to kind of rehab it. But like it's really helpful to have somebody put hands on the pelvic floor to see what might be going on. And so essentially the right half of my pelvic floor is very overactive because that's the leg I stand on. That's the leg a lot of us stand on. We tend to like to stabilize with the right leg. And because it's overactive, it doesn't know how to like let go. And so it's essentially like kind of tight on that side. My left posterior pelvic floor is also a little bit tight, but not as much as the right, because the right side is like firing constantly. And so it's a combination of like common postural tendencies during pregnancy, like my movement habits, like exercises that I'm doing. And so we started incorporating more like internal pelvic floor release with the pelvic wand, in addition to exercises to kind of help release that tension within the pelvic floor, which has one, been helping with discomfort that I'm having. And then two, because it's releasing tension in the back half of my pelvic floor, it's opening that space up more so baby can come more into the pelvis. So right now she sits a little bit forward, which is putting more pressure on my bladder, which makes it gives me this like feeling of heaviness, in addition to like this urgency where like I feel like I always have to pee. And when I go pee, it's like a trickle. And I'm like, that was not efficient. And so because she's sitting so forward on the bladder in that way, she's like kind of engaged, but not like fully engaged, because she's not taking up space in the back half of my pelvis. And so when I release tension in the back half of my pelvic floor, it allows her to better enter, which could maybe put more pressure on the cervix and maybe bring on labor. Who knows? You never know. You never know. So she's definitely engaged somehow. Because my midwife was like, she's very low. Everyone has been like, when I palpate you from the external, she is very low in there. And I'm also like 7 weeks behind in my belly measurements right now. So she's going to come whenever she wants. I'm just going to keep doing my birth preparation exercises, like the pelvic floor release exercises, trying to continue to be at peace that she's going to come, trying whenever she wants. Talk to me when I'm like 41 weeks. And I'm like,
stay tuned.
Very anxious towards the end. But yeah, I definitely feel the most at peace with this labor being whatever it needs to be, however it needs to go. I don't really have like a ton of expectations or like demands of myself. I'm just going to labor and eventually
Have a baby.
push a baby out somewhere, and maybe in the pool, maybe on my bed, maybe on the floor. I don't know. We'll see. Because I think that was something that was really challenging for me in previous births, was I had like a lot of like expectations of I want a water birth, or I want this to happen during my birth, and you don't always get everything that you want.
What you want. I did not get a water birth,
which is fine. So yeah, overall feeling pretty good. Got things to occupy myself with, and then just any moment now. Sorry I didn't have a baby during this video. Maybe next time.
Here for next week.
Tune in for next week. So thanks so much for tuning into what to expect during week 38 of your pregnancy. We are at the end. This may be the last video that I film. This may be the last video that you need to watch. You don't need to watch 39 and 40 and 41 if you're not
part
pregnant
of the 26%
anymore. Let us know how you are feeling during your 38th week of pregnancy. We would love to know what's going on with your appointments, what's going on with you. How are you mentally managing these last few weeks, moments, days, month of your pregnancy? Because it's always really helpful to hear how other people are navigating this stage of their life. If you want more support throughout your pregnancy, we're kind of at the end at this point. We do have some PDF guides that can be beneficial for you, like our labor position guide. Maybe you just want to take like our pushing course. Our condensed course is like a shortened version of our full-length childbirth education course where you can learn about labor positions, comfort measures. But we're kind of at the end at this point. So if you're looking for childbirth education and prenatal support, grabbing our condensed options can be really beneficial. We also do have a pelvic prep for birth course that has some mobility movements in there, some mobility flows as well, if you're looking for some last-minute movement to incorporate into your daily routine. But if you're preparing for the postpartum, because we're pretty much at the end, you could give birth tonight, potentially. We do have a lot of postpartum support courses as well. So we have our postpartum education course and our newborn course, in addition to our free early postpartum recovery course. And we'll link those down below for you, because not only are we preparing for our birth, we also have this whole postpartum that we have to navigate through as well. I think I would rather do labor than the first week postpartum.
The first month postpartum.
That's rough. It's rough.
Physically and mentally. So preparing can increase the awareness of what to expect and make it less kind of scary mentally, and you know how to help yourself physically.
Yeah. I also found having a postpartum buddy, so somebody who gave birth around the same time as me, really helpful, because you can just text them and be like, is this normal?
Oh, I've never had a buddy.
And they can be like, yes, I'm here for you. So I've always had a buddy, which has been really nice.
I've never had a buddy.
If you don't have a buddy, I'm sorry. I'm sorry for the recommendation. But thanks so much for watching this video. Hopefully we'll see you maybe at week 39. Well, I don't know. We'll see. Maybe not. Maybe I shouldn't be hoping
Let
that
us
for you.
know if you think Gina will
I hope
be
you
here
have your
next
baby.
week.
But let me go first, please.